Thanks so much for joining us today for this presentation. This presentation is entitled Implementing HIV Navigation Services in UIO Contexts, and we're so glad to have you here today. Just a brief disclaimer that this event is made possible by the Minority HIV/AIDS Fund through the Indian Health Care. I'm your presenter today. My name is Kayla Emmerich. I'm an HIV Public Health Associate here at NCUIH. I've been here for 2.5 years. I have a background in HIV prevention and research and health education. I also recently was able to attend a training on HIV Navigation Services and cultural humility. So I'm here to share with you what I learned through that process, give you a little primer on these topics, and really direct you to the resources where you can get further training in these areas. Our agenda for today, we're starting with just some welcomes and introduction. I will be going over HNS in UIO organizations. I'll talk through what HNS is and who it's for, the role of the HIV Navigation Service provider, the 5 steps of the HIV Navigation Services model, and we'll touch briefly on cultural humility in HIV Navigation Services. We'll close with some reminders about our evaluation process and upcoming events here at NCUIH, and then we'll adjourn for the day. If you're not familiar with NCUIH, NCUIH is a national representative advocating for the 41 Urban Indian Organization, or UIOs, contracting with the Indian Health Service under the Indian Healthcare Improvement. NCUIH strives to improve the health of the over 70% of the AIAN population that lives in urban areas, supported by quality healthcare centers. As always, your feedback is important to us. We encourage you to take the evaluation of this presentation. You can do that by scanning the QR code here, or the link will be sent out after the fact. So we'll get started with just a little bit of an overview of HIV Navigation Services, or HNS. HIV Navigation Services are all about guiding people with HIV and people at risk for HIV through various services that support their health and well-being. So it's a very overarching definition of what exactly it is we're talking about here today. A lot of different individuals can fill this type of role. At your organization, you may have someone who's designated as an HIV navigator, a PrEP navigator, something like that. Or this may be a role that someone else takes on in addition to all of the other wonderful things that they do for your organization. Maybe it's a caseworker or social worker, a behavioral health specialist, a nurse. This is a type of role that a lot of different professionals can take on. So you can think now about what it is that your organization currently provides. Maybe you do things that line up with navigation services and you're looking to expand those, get a little bit more information on how to improve your reach there. Maybe this isn't something you currently offer, but you can think of some people at your organization that are very well suited to take on this role, or maybe you have room to expand this as a new role in and of itself. So that's the overarching idea of what we're talking about, guiding people with HIV and people at risk for HIV through services that support their health and well-being. At a big picture level, these are the goals of HNS for those 2 particular populations that I mentioned. For people with HIV, the goal is to be fully engaged in HIV care and treatment. For people who are high-risk negative, people who do not currently have HIV but may be at risk for it, the goal is to be fully engaged in HIV and STI prevention services. And overall, for anyone engaged in HIV navigation services, the end goal is self-sufficiency. We want clients to get to the point where they're able to use care prevention services on their own without assistance from others. That's really what the end goal is here. Let's talk a little bit about what HIV navigation services look like for those 2 priority populations. We can start with people with HIV. These are just some of the things that you'd like to think about in terms of helping them navigate to find those services. Linkage to care is going to be very important, especially if it's someone who's just recently diagnosed and has not been in treatment. So linking them to providers who can provide them with HIV treatment medications and other things that are going to support their well-being there. It's also for retention and engagement in care. A lot of folks may start treatment but end up falling out for various reasons. So being a support system to help them stay engaged there is very important. Medication adherence is important for all of that. It's so difficult to start a new medication, especially one that has some difficult side effects like some HIV treatments can. So being a support system there as well. Referrals to other needed services is also a very large part of this. So someone who's to get into care themselves, so providing those services for their partners. STI screenings as well is an important part of that picture, and behavioral interventions, whether that's substance use, mental health support, or other things like that. And finally, there's also connection to other needed resources. This is where the HIV Navigator is really taking on a broader role than just siloed away HIV care, really taking that syndemic approach to see how social determinants of health are impacting an individual's ability to take care of their own health and well-being. That's going to be things like housing, transportation, food, and other medical services are vitally important pieces of getting someone into and retained in HIV care. So when they be at a point where they're not even really thinking about getting on HIV treatment because their most immediate concern is getting into safe housing. So that's an important piece of the role of HIV Navigator, is being aware of the whole swath of services that someone may need to access. The services look pretty similar with some key differences for high-risk negative clients. I will say that's language that we tend to use a little bit more behind the scenes. It can carry some stigma with it to refer to an individual as a high-risk negative. So we definitely encourage you, if you have language at your clinic that feels a little more comfortable, a little bit more patient-centered, to find that language that feels respectful there. We're just trying to find language that refers to people who do not currently have HIV, but may be exposed to it in a variety of contexts, whether that's through sexual exposure or drug use. So in this sort of behind the scenes way, we'll refer to high-risk negative clients, just to understand who that exactly is that we're talking about there. There are some referrals to needed services to think about for this particular population. There's behavioral interventions, and there's also post-exposure prophylaxis and pre-exposure prophylaxis, PEP and PrEP, those medications that can help prevent someone from contracting HIV if exposed. That's an important part of the conversation. And STI screenings are also going to be an important piece of this type of client's care. If they are at risk of exposure to HIV, they're very likely also at risk for exposure to other STIs. So making sure we're linked in with those services as well. Once again, connection to those needed resources is going to be vital: housing, transportation, food, and other medical services. Always just understanding what is the most immediate concern of this particular person. How do I help them support their overall care and well-being? And that's not always just going to be limited to the HIV and STI services. Now that we've got a little bit of an understanding of who it is that HIV Navigation Services are looking to support, we can talk about the role of the HNS Navigator themselves. So like I mentioned, this can be various types of professionals, various types of people can fill this role. More often than not, will wear other hats of your organization as well. But it's important to remember the things that an HNS Navigator is and the things that they're not. So we'll start with what they are. They're very much a resource and a guide. They're there to help find care, facilitate healthcare for the individuals that they're serving in this role. They can be a sounding board or a coach. They can be an advocate for those clients. And they are very much a temporary solution. Remember that the end goal is self-sufficiency for these clients, really building up their ability to take care of their own health, their own well-being. So seeing yourself as a temporary solution as part of this process and one part of a professional care team. It's going to involve a lot of referring out to other professionals. So being a piece of the larger picture is very important when considering yourself an HIV Navigator. The corollary here is that an HNS Navigator is not a permanent solution. Very important to keep in mind, and to really, in the language that you use when working with the client, to really make sure they understand that they're working towards a point where they can do this for themselves, to focus on their strengths as an individual, to help them develop that confidence and competence in navigating through a system. An HNS Navigator is also not necessarily a medical provider or a mental health specialist. They may be. In some cases, if a nurse takes on the role of HNS Navigator, they're also a medical provider. If a behavioral health specialist takes on this role, they're a mental health specialist as well in some regards. But knowing that the HNS Navigator role themselves, if that's not an area of training that they have, they're not expected to be a medical provider. They're not expected to be a mental health specialist. And just being clear on what exactly is being asked of that. we can talk a little bit more specifically about what it looks like to work with a client as an H&S navigator. These are the things that you would be doing regardless of any other training or other hats that you're wearing at your organization. First off, you're very much providing that strength-based support, really emphasizing what it is that the client can do and helping them build up their own skills, their own self-efficacy, and taking action for their own. You're helping them identify co-located services. You're the expert on what the services in the area are, where you feel comfortable referring them to another trusted provider, and making sure they know what's actually available for them. You're providing individualized, patient-centered navigation services and care, very much focused on what the patient or the client is there to receive, on what their most proximate concerns are. So it's not about you making sure that you check things off on a list and make sure you get them into care in one particular one-size-fits-all way. It's about listening to the client and making sure that they have the ability to meet their own goals. A large part of that is going to come like ensuring that action planning with some monitoring from yourself. Coming up with that action plan is a very important piece of the process to help the client understand what types of actions they can take for themselves, what's going to be important for them to meet their goals related to their own health. You're also there to provide support or reminders about visits, whether that's visits with yourself to come back in and check in with a navigator, or reminders for visits outside of your organization when you're referring them to other providers. We can now talk about the 5 steps of the HIV Navigation Services model. So we'll get a little bit more specific about what this looks like from beginning to end. So we'll talk through those steps here, and then we'll get very specific on each one of them. Step 1 is preparation, very key. You'll see it separating from the other steps a little bit. Got to be prepared before you get started. And especially if you're an organization that doesn't currently provide any type of navigation services, you really want to spend some time on this preparation step. You're inventorying resources, both internal and external, and you're establishing those professional relationships so that you feel comfortable referring clients out to trusted providers. Step 2, once you've prepared, you're ready to recruit. You're forming that initial contact with people who may be good candidates for HIV navigation services. That's sharing information about H&S in the communities that you operate within. That's assessing eligibility for H&S. This becomes an important point because there may be people who are living with HIV who are ready to get on treatment, but they may not actually need support from an HIV navigator. They may be already taking those steps for themselves. That's not necessarily a candidate for H&S. So you're really looking for those people who need a little bit more of that support, who have some concerns and some barriers that they're living through. So assessing eligibility in that recruitment piece. You're also assessing readiness to engage in H&S. Similarly, there might be people who have recently been diagnosed, but aren't really ready to take those next steps. So they may not be ready to engage in the process. Step 3 is going to be that first direct engagement in H&S with a client. You're building rapport. You're assessing and working to resolve barriers to engaging in H&S, and you're establishing some expectations and agreements between the two of you. So this is very much that initial visit. Can't expect to fix all the problems, to refer out to every possible service in this initial meeting, but it really is that rapport building step 1 of the actual process. Step 4 is going to include conducting navigation services. So this is where the bulk of your interactions with a client will fall. But you're continually assessing barriers to engaging in prevention, care, and social support services. This is where developing that action plan is going to be very important, looking to reduce barriers and increase access to care. And you're also supporting their implementation of that action plan. This is a place where these individual steps can go in any given order. They can feed back into each other. New barriers might come up as others get resolved. So this is very much an ongoing process. It's not necessarily linear from one to another. And finally, step 5, we're closing the case. We're looking for that level of self-sufficiency so we can conduct a final assessment and provide final referral information to that individual so they have all the resources that they need. As I go through each of these steps, just know with the trainings that you can access on this, we'll spend even more time on each one of these individual steps and walk you through some ways to practice the particular skills that you need for each. And we'll give you the opportunity to ask particular questions about how your organization, if you have particular challenges in providing pieces of this care, You can get answers to those questions. You can work through some of those difficult things. You can talk to other people who are in a similar place. So for today's training, I'm very much just walking through each of these steps with you and would encourage you to find those environments where you can get a little bit more of that individualized training that will help you be really effective for your organization. And we'll talk a little bit more about step one, preparation. So again, we're inventorying your resources. We're establishing professional relationships. Your role at this preparation stage is essentially a researcher or an environmental scanner, working to understand what's the lay of the land here. What do we have internally? Who are we working with externally? What do those relationships look like? The responsibilities that come with this include being familiar with the community that you're working within, especially at a UIO, if you're working with a large Native population in your area, being familiar with that community, understanding their needs and their concerns, having an awareness of the cultural elements that might impact the type of care that you need to provide. You're forming collaborations, both with other organizations and with the community themselves, and you're increasing your knowledge and skills. So part of that preparation can be attending trainings, really getting that in-depth understanding of what HIV navigation services can look like. And that service that you're providing at this particular step, you're becoming a source of information for the priority population that you work with and for your organization. After you've prepared, we're moving on to that recruitment piece. So your role here is as an evaluator, an educator, a recruiter, again, doing that assessment to understand, is this particular client eligible? Are they ready to engage in these services? That's one of the responsibilities that you're looking for here. You also need to be knowledgeable about the program and its goals so you can effectively communicate with people who may be in that position. To let them know this is what we can provide. These are the things we don't provide, but we refer you out for, and this is what we can do for you. You're reviewing some surveillance data to better understand who might be eligible for these services in your area. And that service that you're providing in this recruitment process is providing clients with a description of the program. So you haven't quite done that engagement first visit. You're more just getting the information in front of clients so they understand what the program is and might be willing to take that next step. You might be scheduling appointments to further discuss the next steps to actually enroll in the HNS services as a whole. That brings us to step 3, that direct engagement in HNS. So now you're guiding and delivering information to a client. They've been assessed to be eligible for the program, and now you're actually starting that relationship there. The responsibilities here, you very much do need to be client-centered. I think a lot of times in HIV care, we can get a little hyper-focused on, well, we need to get this person to treatment. We need to get this person on PrEP. We need to get this person tested. And sometimes that can make us overlook the actual needs that a client is expressing in that moment. If a client comes in talking about like, yeah, I just recently got diagnosed, more than anything, I'm worried about the fact that I don't know where I'm going to be sleeping next month. My lease is up and I don't really know where to go. You probably need to focus a little bit more on housing as the client-centered first concern there. It's going to be so difficult to think about getting into treatment and taking more medication and keeping up with these other things if housing is the primary concern. You don't know where you're going. So really taking that client-centered approach rather than an outcome-centered approach on what you as a provider would like them to get to, focus on the client themselves. Part of that is going to require communicating effectively, and this is, again, where that cultural humility and cultural understanding is going to be important. Just understanding that communicating across cultures can be a little tricky. It can be difficult. And it's a skill in and of itself. So understanding the particular needs that the community that you're engaging with and the individual that you're engaging with may have, and how communication might differ from one client. It's important at this stage to listen and focus, again, really taking that client-centered approach. And you do still need to be knowledgeable about the program, be prepared to answer their questions, give them accurate information, and yeah, make sure they know what is available to them there. The service that you're providing here is very much informing the client about the HNS program itself, and you're beginning to assess any barriers that the client may have to engaging in HNS itself. So one of the first questions you may be asking here is, what might make it difficult for you to come back to your next appointment? So they may talk about housing, they may talk about transportation, like I don't have a car, my work schedule is really busy, it's hard to fit in appointments around these things. They might talk about, I don't really want my roommate to know that I'm going to see somebody for HIV services. This may be place where some stigma and some very, very fundamental concerns about housing, food, transportation come up. So assessing those barriers is going to be a really important piece of it. After that first engagement step, now we're conducting navigation services. This might be a longer series of appointments and visits with a client, and you're very much acting as that guide and that supporter. At this point, you should be familiar with services in the community. So you may be talking about referring someone to some transportation support. You may be referring someone to STI screenings. You might be referring them to a provider that can get them on HIV treatment. So really knowing very fundamentally where those services are and the best way to refer a client to them, that's going to be a really important piece of this step. Knowing how to assess their barriers and problem solve, also going to be very fundamentally important, especially because this is a place where maybe you're resolving some barriers, but other ones are coming up. So being willing to continue to listen to your client and problem solve actively with them in the moment. This is also where having the skills to develop an action plan with your client is going to be so important. Having it come from the client, these are the goals that I'm working towards, helping them establish, okay, these are the steps that I can take to help myself get towards those goals, and monitoring that as you go. That's a very fundamental piece of this process. And again, I will mention that the trainings you can take on this will give you some excellent paperwork and just templates for how to develop that action plan and develop that as a skill. So you'll have even more resources to work with to ensure that you really have that as a skill in and of itself. So again, really the service that you're providing here, you're addressing barriers and you're developing that plan of action. That's an ongoing process that will probably be where the majority of your time with a particular client is spent. And finally, you are closing the case. Your role here is as that navigator, as an evaluator, to really take on that responsibility of being able to determine if that action plan has been completed. If you see that someone has reached that level of self-sufficiency, they maybe don't need their reminders for appointments as much. They've gotten on their medication and their adherence is looking pretty solid. They have, a high aptitude of being able to call in and schedule their own appointments. Looking to determine, does this look like someone who's self-sufficient, who's ready to take on these actions themselves? We want to continue communicating effectively. You never want to assume that someone has reached that point of self-sufficiency. You want that to be a conversation in a place where the client themselves feels that they have the capability and they have the confidence to take on their own services going forward. And you do want to determine if further action is needed. Maybe they do need a referral to a mental health specialist. Maybe they need connection to a primary care provider. Maybe you are ready to close the case, but they do need some resources to make sure that they're going to be engaged in care and taking care of their own well-being. The services that you're providing here, really making sure to acknowledge the client's accomplishments. Things that may seem small, whether to the client or to yourself, are such big deals. Well, sometimes, maybe somebody got a new job. That's huge. That's a huge accomplishment. Maybe someone went in for testing for the first time. That is such an accomplishment, even if they're downplaying it themselves, or even if it feels like such a small step in the process. Really emphasizing the strengths and the abilities of your clients goes a very long way. And providing that client with the final information, those referrals, those connections, any ongoing resources that they do. That's really part of closing the case. Once again, here's that big picture look at the HIV Navigation Services model, walking us through all 5 steps. We're getting prepared, we're recruiting clients, we're engaging clients in H&S, we're conducting HIV Navigation Services, and finally, we're closing the case. So this might be a point where you're thinking about some of the potentially difficult things that can come up for you as an HIV navigator throughout this process. I won't have a lot of time to touch on that today. And once again, attending these trainings where you're able to really workshop them and talk about some of those deep details of what does it look like to establish boundaries with the client that you're working with and make sure those are respected on both sides. What do you do when you lose someone to care? You've had someone coming in for some of these appointments and when they stop showing up, they're not answering their calls. What do you do next? What do you do when you have limited resources? What do you do when you refer someone out to a provider and they come back saying they have a really negative experience with them? So these are some of the challenges that you as an HIV navigator may have to work through. And the answers are going to look a little different from one situation to the next. So I encourage you to continue exploring all of the avenues for training in this area, connecting with other navigators who are very experienced, who can guide you through that, and just understanding how to kind of prioritize what's needed for your organization in this moment, even as your client interactions look a little different from one to the next, and you encounter those challenges as you go. And so the last bit of this presentation today, I'm going to touch on the importance of cultural humility within HIV Navigation Services. This is also an area where there are a lot more in-depth presentations than what I'll be able to provide today, but do really want to emphasize how important it is that we bring cultural humility as a skill and as a mindset to these interactions. Culture is so fundamentally important to human behavior, human society. Culture impacts an individual's attitudes and behavior. It affects how people interact with the world around them. It also affects how people are perceived by others. So it shows up in every facet of life, and HIV Navigation Services are no different. A navigator will need to work with populations and cultures that may fall outside of their own personal understanding of culture. If you think about attitudes and behavior, attitudes around sex and what's appropriate to discuss even with a medical provider, that's going to differ from person to person. The ways that people communicate, it's going to look different from person to person, from culture to culture. So being prepared to interact with people who communicate differently from you, who have different attitudes and different behaviors from yourself, that's going to be vitally important to this process, especially when HIV is concerned. And we can look here up the definition of cultural humility. Cultural humility is an attitude through which an individual learns about other cultures in conjunction with becoming more aware of their own beliefs and identities, intended to result in mutual understanding, equity, honesty, and trustworthy relationships. Cultural humility is a lifelong process of self-reflection and self-critique. So embedded within this is the understanding that you're not going to be perfect. There is that element of self-reflection. Self-critique is a necessary component. So being able to acknowledge when maybe you've misspoken, maybe you've misstepped a little bit, maybe you could have been a little bit more culturally sensitive, maybe you could have understood a little bit more of where someone was coming from. And this is why that emphasis on patient-centered care and really listening to what the client is bringing to you is such a vitally important piece of that engagement step, because you never want to bring your own assumptions about what someone should be vocal, should be doing, what should be behavioral into these interactions. We know how important of a factor stigma is in HIV care, and that gets more nuanced and layered and complicated when you bring in different cultural understandings of sexual behavior, different types of interactions with the medical system and medical trauma and historical trauma, and the ways that it can show up in interacting with health professionals. That's going to be different from person to person. And especially thinking about working with Native communities, having the understanding of where they may be coming from. They may be hesitant to talk about certain sexual matters. They may be hesitant to go to a medical provider, and making sure to approach that with an element of humility here, of looking to understand and learn, and looking for that mutual understanding, rather than trying to push someone to an end goal of getting on medication, doing their screenings, taking PrEP, whatever it may be. That's why this is a really important facet of the HIV Navigation Service. And we can look here about the tenets of cultural humility. Cultural humility, once again, requires a lifelong commitment to that self-reflection and self-critique, remedying the power imbalance between client and provider, and developing mutually beneficial partnerships with clients' communities. So it's a much larger process than, even if you are able to attend a training on developing cultural humility and cultural competence, really continuing to develop those partnerships, those relationships, being embedded within community is going to be such a vitally important piece of this. Trust between the client and provider, and also the trust between clients and the people that you as a navigator refer them out to, is fundamentally important and necessary here. That is honestly one of the biggest challenges, is having clients referred out to providers that they then experience discrimination and that they aren't treated with respect. Their language isn't respected, their name isn't respected, their background isn't respected. So both understanding yourself, how to engage with that client in that respectful way, and also understanding how to build partnerships and be within communities so that you are referring people to organizations that you trust and that you can vouch for, and you can make sure that their care continuum is full of people that will actually support and listen to them. It's foundational to this. You can't really do HIV navigation services without it. So really bringing that cultural humility mindset to the forefront is going to be so important. There are a lot of trainings out there about this. They're great places to role play a lot of different scenarios, role play having a conversation with someone who communicates very differently from you, role play having conversations about difficult subject matter that someone might be a little more hesitant to bring up, and really work through and develop those skills, because they are skills. The idea of this being a lifelong process is so important. It's not just, again, a box that you can check to say, yep, I have cultural humility now. It's an action more than a piece of knowledge in and of itself. So getting into these types of trainings in these environments where you can really practice that as a skill is going to be so important. I will close today by pointing you towards some further trainings and resources. The number one resource here being the CDC's National HIV Classroom Learning Center through CAI Global. You can visit their national training calendar at the address listed there. The link will also be sent out, and you can email their team. Again, we'll send out that email address. They have provided AIA and specific trainings on this subject in particular, and can get people that certification in HIV navigation services. Again, much more in depth than I'm able to provide for you in just a short amount of time today. I highly recommend seeking out this training. They do provide a lot of financial support to make sure that people can attend these trainings. I'll also point you towards the Albuquerque Area Indian Health Board, AAIHB's Community Health Education and Resiliency Program, known as CHIRP. They have a lot of different trainings that they provide related to HIV and STIs in general, also related to cultural humility. Their wonderful trainers there are so great to work with. And they can really provide that sort of individualized training that you and your organization need. So I highly recommend reaching out to them. And with that said, once again, your feedback is so important to us. Please let us know what you thought of today's presentation. You can scan the QR code there or click the link that we'll send out. And I do want to remind you that we, NCUIH, provide one-on-one technical assistance that is available. And that can also be a starting place if you're thinking about the HIV navigation services that your organization provides or would like to provide. That's something that we can help with as well. Our Technical Assistance and Research Center, or TARC, provides individualized technical assistance, training, and support to member UIOs. That individual support can include any of the following here: community and staff training, consultation on research and evaluation, consultation on program planning and implementation, documenting local best practices, grant application review, local partnership development, locating archival data to support community work, and policies, procedures, and operational needs. So really, if you have a question, if you have a concern, if you have something you'd like to work through, request some TA from us. We've got our link there up at the top. And once again, we'll send that out after the fact. We're here to support you. We'd love to hear from you. We do have some upcoming events and funding opportunities listed here. On September 26th, we've got Managing Healthcare Operations, Grant Requirements for Sustainable Planning. And on October 10th, Managing Healthcare Operations, Fundraising and Capital Campaigns for Urban Indian Organizations. And we've got a funding opportunity, that HRSA New Access Point NAP's application deadline. We're reaching kind of the end of this application period. They were due on August 30th. And on grants.gov, and then in HRSA's electronic handbook on September 30th. So a little bit of time for that one as well. Thank you so much for your time today. We look forward to seeing you in the future.